Welcome to Golden Isles TV. I'm your host, Avery Brooks, and today we're talking about spinal stenosis. Please join us at the Spine Center of Southeast Georgia as we talk with Dr. Manny Gage about innovative treatment options. Stay tuned, it's all coming up next, right here on Golden Isles TV. Hi, welcome back to Golden Isles TV. I'm your host, Avery Brooks, and I'm here with Dr. Gage. How are you?
I'm good. How are you doing?
I'm good. Thanks so much for allowing us to be here today.
Oh, anytime. We're happy to have you. We appreciate it.
Yes. So tell me about where you're from, a little bit about your background.
Okay. So I actually grew up in the Midwest. I was born in Chicago, but grew up, spent most of my time in Ohio. So I'm a Buckeye fan. Sorry, Georgia fans. But I lived in Youngstown, Ohio. I went to medical school in Toledo, Ohio. I had gotten accepted to medical school early, and I did not have to take an MCAT for it, so we were like, yes, so we went there for school.
Yeah.
I went to residency, University of Toledo, and my residency was in physical medicine and rehabilitation. A lot of people don't know what that is. The easiest way to explain it, it's a combination of orthopedics and neurology. So we kind of look at, instead of just treating a condition, our big focus is getting patients back to their normal everyday activities. We're one of the few specialties where you might come in and we'll ask, how many stairs do you have in your house? How many people live with you? Do you live on the first floor or the second floor? Because all of our focus is really on getting people back to a good quality of life.
Right.
After I did my residency there, I actually stayed on and did a pain medicine fellowship there. We did a lot of focus on spinal medicine, so a lot of interventional procedures, and then a lot of conservative care as well too.
Great.
Good, yeah.
And you, I heard you were one of the first to do this new procedure that we're going to talk about, the Veriflex.
Yeah.
Is that right?
That is correct, yep. I moved down here now coming up on 5 years, and about 3 years ago, I came across a partner of mine down in Florida who started doing this procedure, and he was saying, I'm getting fantastic results, you've got to look this up. So I actually contacted the company, and they're like, we're still in the trial mode, we're not just letting anyone do this procedure, you actually have to come through and test with us first. So myself and my partner, Dr. Bovenay, we both went to Atlanta. We did some training on the procedure. They actually said that we tested very high and that we were very capable, so they would allow us to do the procedure. So after that, we did the first one here in 2017, and up to this point, we're coming up on almost 100 of them.
Wow.
Yeah. So.
That is very exciting. I'm always excited about stuff like that coming to Southeast Georgia.
Yes.
People think, oh, we're a small area, we're a tourist destination, which we are. However, great to know that these innovative procedures are right here.
Definitely.
In the Golden Isles.
Yes. Yeah. So this procedure is state-of-the-art, not brand new. It's been around for almost 2 years now, but it's been really nice to bring it to Brunswick, to St. Mary's area, both Glenn and Camden counties, because this is a procedure most people would expect I should go to Atlanta or go to Jacksonville at Mayo, but we're doing a lot of state-of-the-art things here.
That's great. Today we're talking about spinal stenosis. So let's get started.
Yeah.
Exactly what is spinal stenosis?
So spinal stenosis is a pretty common degenerative disease that happens in people as they get older. So in the simplest form, we tell people it's actually narrowing inside the spinal canal. It can happen in your neck, your middle back. Most commonly, it happens in the low back. And this can happen as people get older and they get degenerative disc disease, which I'm sure you've heard. Everyone has some degenerative disc disease. That's one of the reasons everyone loses a couple inches as they get older. But we can help with some of those symptoms. So as you get older, you might have disc bulges, you might get inflammation in some of the joints, get arthritis, and all those things start to grow in around the spine. And as that happens, our spinal canal should have enough room for all the nerves to fit inside of them. But if it starts to get enclosed in from the sides, it starts to pinch on the nerves. Now in spinal stenosis, most patients will start to notice that they are actually having more pain when they stand up and walk. And the reason for that is when you actually stand, the spine tends to turn backwards a little bit like this. In that extension position, you actually put more pressure on the nerve roots. So you'll actually notice a lot of people sometimes out at the grocery store or shopping where they're actually leaning on the shopping carts a lot. And one of the reasons they do that is when you lean forward, it actually helps to open up space for the nerves.
Wow, so interesting.
It is, yeah.
So spinal stenosis can be a debilitating condition.
It can.
But there are minimally invasive treatment options. Can you tell us about that?
Yeah, here at the Spine Center, we try to be as conservative as we can. So a lot of patients might show up with with symptoms that represent spinal stenosis. First thing is first, we always examine the patient and make sure that's actually what they have going on. A good physical exam and a history from a patient gives us a lot of information. Then usually what we do next is get x-rays. We might get an MRI to actually have a closer look at what the nerves and what the spinal canal looks like. If they do have spinal stenosis, then we do have a number of options for them. First option is usually as conservative as possible, get them into some physical therapy or possibly work with a chiropractor and see if we can get them to stabilize some of the spine muscles, strengthen their core muscles, stretch their hamstrings. A lot of those types of things will actually help alleviate some of the pressure on the nerves in the spine. If that doesn't help, then we can go on to some other options. That might be anything from anti-inflammatory medications. It might be to nerve medications, similar ones to Neurontin, gabapentin, Lyrica, and those are medicines that kind of help to stabilize the nerves where they're actually getting pinched. If the medications don't work, we can get a little bit more aggressive, and that's when we talk about injections. Some injections that we have are epidurals. They're a lot different than the epidurals people have when they're having a baby or having surgery. When we do an actual epidural for the spine, this is what we usually look at as the back, okay? So this is our back, this is usually down where the buttocks is. And if we look at the side, you'll see these is where the actual nerves come out from the spine. So when we do an epidural, there's a few different approaches that you can actually do the injection. We do all our injections using an x-ray machine. This is our fluoroscopy machine. It's very low risk because we can see exactly where we're going with the injection. But typically we'll go in at the spot where the nerve is getting pinched, for instance, so we might go right here if it's our nerve that's getting pinched. And then we usually inject a little bit of numbing medication and a little bit of steroid. And the numbing medicine usually gives people relief right away, and then the steroid injection usually helps over a couple days and hopefully bring down a lot of the inflammation on the discs and the nerves. And then patients can get a really good long-term relief with that. If they don't, we can talk about more aggressive options. A minimally invasive option that we have for them is called Veriflex Superion, which is a little wedge or spacer device that we use that we can do as an outpatient setting. I tell people it's very similar to what you see in the commercials from the Laser Spine Institute. We're not using any lasers, but it's the same little half-inch incision and you're walking out with a lot of pain relief. Then our most aggressive option would actually be setting on to possibly surgery.
Wow. So you start with, as minimal as you can and kind of
Correct.
move up depending.
Exactly. And most patients do really well with the conservative route. I'd say probably 75 to 80%. But some patients don't because the significance of the stenosis is there. So then we try some more aggressive options, and that's what some of these are.
Let's talk about Vertiflex, right? This is right. So tell me who would be a candidate and what the requirements for a patient would be.
So Vertiflex is an innovative new product that's been out. It's been FDA approved for a number of years. It's actually been covered by Medicare since the beginning of 2017. I was actually the first physician to perform an implant here in Southeast Georgia, and we're still the only practice that offers it. But it's a pretty amazing option for patients who have stenosis. In order to be a candidate for it, we usually get an MRI and we make sure how severe the stenosis is. So you do have to have at least moderate stenosis. That's one of our big factors. Also, we usually only do it in patients who are over 50 years of age. The reason for that is we want to make sure that you don't have too much osteoporosis, but we also want to make sure that the condition doesn't look like it's going to progress and might require surgery later on. We also do check to see if you have any kind of osteoporosis. And then one of the big tests that we ask is, and this is something patients can even do at home before coming in, is we want you to kind of stand and walk. If you're able to walk for 5 to 10 minutes before you start having the severe pain and having to sit, then you're a good candidate. Now, if you actually have relief as soon as you sit or after a couple minutes, or you have relief when you lean over, I'll have a lot of patients who tell me, I can walk around the grocery store all day if I can lean on that cart. But as soon as I am off the cart and have to stand up, after 5 to 10 minutes, I have to take a seat.
So is that because pain in their back, or they're starting to feel numbness and all that in their legs?
Good question. So it's usually, it can be a combination of both. Most often patients with stenosis will complain of heaviness in their legs, some nerve numbness, tingling, and it could be anywhere from the lower back, the hips, the thighs, the groin, and it can go down the legs depending which level their narrowing or stenosis is at. Also, some patients, when the stenosis gets worse, they'll actually start to have a little bit of back pain.
So, Dr. Gage, let's talk about the procedure itself.
Okay, so what we call this is actually a minimally invasive outpatient procedure. When we do this procedure, patients will usually come into our ASC, our surgical center here. We'll usually get them dressed into a gown. We will give them a little bit of IV antibiotic before, Never had an infection, knock on wood, so I don't want to have any yet. But typically we'll bring the patient into the room. We'll actually have their back clean with sterile solution, put a sterile drape over them. The entire procedure is done very sterilely. After we clean their back, we spend a lot of time making sure we get the proper alignment for the level that we're going to do the implant at. When we actually get ready to do the implant, after we've lined things up underneath our fluoroscopy, we'll actually make a little mark on the skin, and then we'll numb the skin. The actual incision for this procedure is less than 1 inch. Most patients about 1/2 inch. What we'll do is after we numb the skin, we'll take a small little needle and actually take it down between these two bones called the spinous processes. We actually have another dilator that goes over the first needle, and what that will do is actually grab onto the bones. Once we get that dilator in place, we take a little device to measure the size that you would need. This actually comes in 5 different sizes. So everyone's spine is a little bit different. It doesn't mean if you're a big person, you're gonna need a big one. If you're a small person, you'll need a small one. I've had 90-pound, 85-year-old women who've used the biggest size, and then I've had 350-pound gentlemen who've used the smallest size. So a lot of it has to do with just how much space there is here. Now what we're trying to do with this implant is, if you can kind of see, if this is the spine in a neutral position, if the patient stands up, you'll see it starts to narrow up at the spine, especially where these nerves come out through there. Once we get their proper size actually measured out, we'll take this little device, and this is what the little spacer looks like. It actually comes folded forward. So the reason the incision can be so small is that this little spacer will be folded forward. It goes into the spine in between the bones like this. Then we use, for lack of a better term, a screwdriver, which actually helps to open up these little prongs, and it will grab onto these bones so that it's not going to slide or move around at all. After that, we take the little dilator out. We end up closing the incision. The patient can stand up. The entire procedure now takes about 15 to 20 minutes. It's a pretty quick procedure. And now what you'll notice is that when the patients go out into the waiting room or into the recovery room after the procedure, if they try to stand up, now that part of the nerve doesn't get compressed, but you'll see that the level above does get narrowed. Okay, so that's what would happen if you had stenosis. Now that you don't have the stenosis, that nerve stays wide open.
I see.
So a patient's able to stand and walk without the pain that they were normally having before.
Wow, that's great.
So yeah.
What a great procedure, and it sounds really quick and easy.
It is. It's actually pretty quick and easy. With any procedure, there's always some risks, okay? So there's always risks that you can have, but we usually go through that with the patient. Depending if they have any other medical conditions, we might get a clearance from their family doctor or their cardiologist. But it's a very low risk procedure. And one of the most innovative things about this whole procedure is other products similar to this in the past required for you to actually cut out pieces of bone from the spinous process, removing tissue, removing ligaments. So therefore, there's a lot of bleeding, a lot of pain after the procedure, and a very long recovery time. With this, we're actually leaving all the bone intact, all the ligaments are intact, so this is a completely reversible procedure as well too. And that's what a lot of patients like. This really gives them a big option to gap between conservative options like physical therapy, medications, injections, and then the most aggressive option, which would be surgery.
Okay, nice. Is that made of, what is that made of?
So it's made of titanium. It's made of the same material as knee replacements and hip joint replacements. So, you know, they do give you a little card in case you go to the airport. You can present this to them so that they know that you might beep or anything like that. But
the alarm's going to go off.
Yeah, yeah, you don't want that. So, but they'll usually look and see that you have a small incision if that's any kind of issue. But
nice. Yeah. Great. And how long has that been around?
So the product's been around for close to 10 years that they've been working on it. For the last 5 years, they've actually had FDA approval for it, and they actually put it through a very vigorous study. This was actually one of the most studied spinal stenosis products on the market. And because it's so different than a lot of the other ones, they really had to prove that it was going to provide relief for patients. A lot of physicians or anyone in the medical field may tell you that Medicare a lot of times is one of the last to approve some of these new procedures, but they actually had such good results that Medicare was the first to actually cover this. So Medicare patients have a really easy time getting this approved for them, and a lot of secondary supplemental insurances that they have do as well too. So the success rates have been really high.
Yeah, it's good to know. Yeah. So So Dr. Gage, this is a great procedure. How soon do patients see results?
It's a great question. So a lot of our patients will actually tell me that they notice results on their way out walking to their car.
Wow.
So it's that quick of a response.
Yeah.
I mean, I can tell you there is a patient that we've done recently who was an avid bike rider before. He was actually a physician in town, and he was having severe pain, unable to ride his bike. And I can tell you 3 weeks later, he was riding about 30 miles a day.
Oh my gosh.
So that tells you like a little bit of the middle term in terms of the results. So a lot of patients will say, and I would say about 50% of the patients have relief immediately. They'll notice that they have improvement of their pain as soon as they walk out the door. Some patients will be sore, understandably, for the first day or two because we did do a little surgical procedure. I can't tell you from my personal experience, over 90% of the patients have come back at their first follow-up, which is usually 7 to 10 days later, and they describe that they're having at least 80% of their symptoms gone.
Wow.
Most of their discomfort is still from the staples and the stitches. So once we take those out, they really feel good by their second or third week.
That's excellent.
It is.
So what are the long-term results? So they see
Yes.
results quickly,
Yeah.
but how long are they?
Correct. So this is meant to be a permanent long-term fix, okay? I did mention that it is reversible for any reason if it needed to be taken out, but it's not meant to be taken out at a later date. So what they actually did in this study with this product is they compared it to the surgical procedure, which is a little more invasive. In that procedure, what they'll do is if you have spinal stenosis, you want to open up the space. So the way that you do that surgically is you actually make a small incision. They do this under general anesthesia, which means that they actually intubate you. When they do that, they'll actually cut out some bone and take out some ligament to open up room for the nerves on the inside portion. So they compared this implant, which is a minimally invasive procedure, meaning that you get the same medication through an IV as you would when you have a colonoscopy. So you're a little bit sleepy during the procedure, and you wake up and you're back to normal within 30 minutes. Now at 4 and 5 years after this has been implanted, all the patients are getting at least 78% still getting 78% pain relief of their stenosis symptoms.
Wow, so that's a great success rate.
That's a huge success rate because that's one of the things we always try to avoid in spine care is surgery is usually like a last resort. And sometimes surgery helps a lot of patients, especially if they have severe stenosis. But in those that only have moderate stenosis, it's a great option before jumping to a surgery.
September is National Pain Month, and Dr. Gage, can you speak a little bit about that? I know there's a big
Yes.
problem with the opioids.
There is.
It's a national, if not universal problem. Tell us about that.
Yeah, so September is National Pain Awareness Month. There's been a lot of focus, if you watch the news at all, on opiates. There's been a high number over the last 10 to 15 years of opioid abuse, opioid overdoses, and that's kind of come to a head in the last 5 years. The government as well, if you watch 60 Minutes, every other week there tends to be a story on this. A lot of news channels talk about it. And a lot of us have been touched by people who have either had a problem with pain medications, also known as opiates, or may have had addiction problems. And not necessarily always addiction problems, it might be dependence where they become reliant on the medication. What's ended up happening over the last 15 years is we've unfortunately seen a rise in the amount of overdoses and deaths. So a lot of studies over the last 5 years have been aimed at figuring out why are these happening. So in 2017 alone, there was over 72,000 people that died of overdose in the United States.
Wow.
So it's a lot of people. That's over almost 145 people per day. Georgia ranks 11th overall in the country on that in the amount of deaths due to opioid overdoses. And a lot of these things I tell people is there's a lot of other options before we try to go to the pain medications. And then even patients who are on pain medications, they have a hard time living without them because they have such severe pain either in their back or from they've had a surgery. And sometimes some patients really need them. Okay, but sometimes other patients, we try to find other options for them so they don't have to rely on the pain medication as much.
Right.
So typically we try to work with the patients and come up with other options if possible. If they do need pain medications, we always try to keep it within a safe limit.
Right. Thank you so much for your time today.
No problem. Thank you very much. I really appreciate it. It was a pleasure meeting with you.
Sure.
And I just want to ask everyone out there, thank you for spending the time watching our video. Feel free to come to one of our clinics if you think you might be a candidate for this option. And we have a ton of other options for you as well too. We've actually got 2 locations. We're here in Brunswick at 1111, so 1111 Glencoe Parkway. And then we're also down in St. Mary's. We're at 52 Lindsay Lane over in St. Mary's, Georgia as well too. And be sure, if you want to learn more about this procedure or other procedures that I do, that we do here at the Spine Center, we are on social media, of course. Everyone is right now. So if you follow me on Facebook, just search for Dr. Emmanuel Gage. If you're on Instagram, it's dr.mannygage. And you will see a few videos where we actually post where I've done these procedures on patients, and you can actually see a little more of what to expect when you come to see us.
Great.
Okay.
Good to know.
Thank you.
Thank
Again,
you.
I appreciate it.